Hi, everybody. Welcome to the Southern Arizona Attractions Alliance's May meeting. Today, our topic is planning a relaunch of your attraction. Let's all work together. A few housekeeping rules to ensure a good webinar. Please mute yourself during the webinar and turn off your video. This will allow the panelists to be seen. There will be a Q&A session following the panelists. However, we will have a short Q&A with the Pima County folks right after their talks. Please ask your question in the chat room and identify if there is a particular speaker you want to answer your question, or simply put anyone on the panel. Okay, so let's get going. Our first speaker is Wendy Roundtree, and Wendy is the president of the SAAA. So Wendy, please go ahead.
Good morning, everyone, and thank you for joining us. I, as well as you, I'm sure, look forward to a lot of really good information on how we can hope to reopen all of our attractions and venues in the coming weeks and months. And I will kick it back to Tom to introduce the panel of guests and start the webinar. Thank you again for attending.
Thank you, Wendy. And good morning once again to everyone. Today we have a distinguished group of presenters, and you may feel at times that it's like speed dating because they got a lot to cover and I've only given them 5 minutes. So feel free to write down your question in the chat room and we'll try to get to those at the end of the conference. Our goal today is to give you an overview of developing a reopening plan. Of course, following the recommendations from Pima County Health Department and the state of Arizona. There is so much more to developing a plan than recommendations from the government, but all good plans will start with our local, state, and federal guidelines so we can open safely and instill consumer confidence at the same time. So let's kick off the webinar with a brief introduction of our esteemed panel. So let me share the screen as I get a chance to introduce all of them. Our first guest is going to be Aaron Pacheco, and he is with the Pima County Public Health Department, and he's going to give an update on the COVID-19 virus and how is it affecting our region. Our second speaker, also from Pima County, is going to be Diane Frisch, and Diane is the director of the Pima County Attractions and Tourism. She's going to talk a little bit about the Back to Business Task Force that is meeting this week and preparing guidelines to help all small businesses and all industry within the community to reopen and reopen safely. Following Diane, Mary Rittman. She is the Vice President of Communications and Tourism for Visit Tucson, who is our DMO, our Destination Marketing Organization. And she'll be talking about really how can we gain this consumer confidence back. Next speaker is Bob Roshi. Bob is the Executive Director of the Arizona State Parks and Trails. And Bob has a very unique story to talk about because while their gift shops have been closed and some of their other buildings, they basically have been operating, especially their outdoor trails. So Bob's going to give us a unique perspective on how to continue to operate during the COVID-19 pandemic. Followed by Bob is Amber Smith, and she's the president and CEO of the Tucson Metro Chamber. They have been very active in helping small businesses here in town maneuver through all of the grants and loans that are available to help keep our businesses operating. Kate Marquez will be following Amber, and she is the executive director of the Southern Arizona Arts and Cultural Alliance. And they're very unique in the sense that they do both festivals and they operate the Catalyst Arts and Makerspace in the Tucson Mall. Once once Kate talks, then we're going to kind of take a national look of how the attractions are preparing to reopen. As we all know, around 30 states, and you have one way or another begun to reopen their economy. And likewise, Arizona is just beginning to open their economy, but we have a long way to go to learn what's the best way to open safely and instill consumer confidence. So John Hallenbeck, who is the Vice President of North American Operations for the International Association of Amusement Parks and Attractions, has been actively working with their attractions, which are located throughout the world. After John, Kenneth Vondreska will be talking. He is a safety and operation consultant. He's our man on the ground. So he is working with small and mid-sized family entertainment centers, amusement parks, theme parks, water parks, zoos, and aquariums in helping them prepare reopening plans. Mr. Stone will be talking about public relations and communications to our consumers to once again help instill customer confidence that the attractions are ready to open. But he'll also talk a little bit about the importance of employees and their confidence and how important that is as well. Last but not least, we're going to have a panel from the insurance companies here in town. Crest Insurance has come forward and has actually developed a plan on how to reopen your business. So they'll be sharing some details, and everyone will get access to that plan. So Jay Height will introduce several of his members to talk about risk management and how you need to work with your risk managers while you're developing your reopening plan. So that kind of wraps up really who the speakers are going to be today. It's quite a few speakers. So I asked the panel to do your best to keep it to 5 minutes and just talk through the highlights, and then through either the chat room or questions afterwards. We hope that we'll be able to get to everybody's questions. If not, please utilize the chat room, and we'll send these questions on to the panelists, and they can get back with you on an individual basis. So thanks again to the panel. And I'm going to stop sharing, and we'll get back over to the cameras. So our first speaker is Aaron Pacheco from Pima County Health Department. So take it away.
Yeah, thank you very much for having me. So I can talk a little bit about today. What I'm hoping to shine a little light on is going to be just sort of what public health's role here in Pima County is when it comes to the impacts that our surveillance and tracking and capacity will have on these conversations as we talk about reopening things. My role here with the department is community relations. So I do a lot of trying to sort of bring the information that we're developing and put it into the public space for folks to consume and take a look at. So I'm hoping to be helpful in doing that for everybody this morning. I want to briefly, like I said, just sort of go over what our role here is locally and how that ties into this conversation, starting with the surveillance that we do. From a public health perspective, surveillance is something that everybody's hearing a lot about right now. It's all of the tracking of numbers and cases and all of that sort of information. The way that information here locally is being used to help us understand what's going on and how it can help us make decisions about reopening really keys in on the work that we do to understand the number of cases that are happening here in Pima County, and identifying the trends over long periods of time. Right now, folks are really interested in, okay, what was the case count yesterday? What's the count today? Where are we going? What are we seeing? And what we really have to be doing as we look at that information is look at it over longer periods of time, starting, here locally, at least at the beginning of March, when we first started identifying cases. So we are tracking that sort of information. It's informing the criteria that we're using to make decisions about the phases of reopening here locally. That's something that you can find on our website. If folks are interested, I can also send the link. I'll throw it in the chat comments as well, so that people can find that. So those are criteria around, how many cases are we seeing right now? How many deaths? And what is the trend of those numbers? If you look at the criteria right now, the trend is generally that we're looking a little bit better than we have been over the last few weeks. But one really interesting fold that I just like to point out as we talk about those sort of things is that the way that surveillance works, we really won't see the impacts of reopening, the impacts that new strategies have, generally for about a week or two, reflecting in those numbers, mainly because of how long it takes for folks to develop symptoms, number one, and number two, how long it takes for us to get those results back from a laboratory once somebody is tested. And so that can sometimes mean that we need to take a look back further than those initial couple of weeks to really understand what's happening as we see people kind of coming out more often. We won't see those impacts right away. And that's something that we in public health, of course, try to pay a lot of attention to. The other part of the work that we're doing is to support healthcare capacity. The conversations that we're seeing about personal protective equipment, and the hospitals being able to do medical surge planning. Those are all things that we have been helping with. And the way that impacts our criteria in making recommendations about reopening is that we want to make sure that if we do see an increase in cases, and especially if we see a surge of cases and poor outcomes, that the hospitals can handle that surge. That's what all of this, flattening the curve conversation has been all about, has been to make sure that our healthcare system is in position to manage an influx of cases should we see one. Those are also things that influence the criteria that we're using to sort of track and make decisions. The last is our public health capacity to do investigations and prevention work. It's the other thing that you're hearing a lot of conversation about, which is contact tracing. So in the criteria that we set forth for the county, there's also criteria that measures our ability to do that sort of work locally, to quickly identify, investigate, and then do surveillance around new cases and outbreaks within the community so that we can prevent the spread of infection. And that's all about identifying cases quickly and then identifying contacts to those cases so that we can get them education and testing and everything that they need to keep them from spreading the disease. And so our main goal right now, one of our big focuses, is making sure that we're beefing up our capacity to do that sort of work. Over the last month, our capacity, just from a staffing standpoint, has gone from a team of less than 10 to now a team of nearly 30, with at least 50 more in addition to that 30 coming online kind of as we speak over the next week or so, and continuing to grow beyond that. And so we're trying to put a team together with help from the state health department as well. They're doing a lot of work in that arena. And so what we're hoping to do is have the public health healthcare and surveillance infrastructure in place, so that as we start see people starting to come out and enjoy everything that our community has to offer, that we are not only doing it as safely as possible, but also that we have the infrastructure in place to mitigate the spread of disease that would be expected as people start to be out and about more.
Great. So thank you, Aaron. Just as a reminder, we will have a short Q&A after the next speaker. So Diane Frisch, the Director of Pima County Attractions and Tourism. Good morning, Diane.
Good morning. Can you hear me?
Yes, we can.
Great. Thank you for inviting me to participate today. As some of you may know, others maybe not, the county has been holding a series of community task force so we can get input from everyone who's actually an operator on the ground running attractions, bars, restaurants, pools, hotels, everything you can imagine. So we get their input and we can say, what are the things, the criteria that's most important to you? Where do you need help? As you know, we are under the rules as the governor has his executive orders. So sometimes we get an order or announcement and that may change what we've been putting together or doing. We're looking for uniformity and something that's clear to everyone, so you're not getting conflicting information from the state, from the city, from the county. Our health department is really leading that charge based on the safety of our residents, on the safety of your staff and whatever visitors. A couple of things to know that we've looking on, and in the meeting we had at 2:00, every day at 2:00, we're having meetings that are open. You can watch them on Facebook. Go to Pima County Facebook page and you can see those meetings. They're recorded so you can watch them later, but input from operators about what's concerning to them. For the attractions and tourism industry, it's particularly, we've been very hard hit, but there are a lot of circumstances that affect everyone there. Some of the things we talked about yesterday, indoor venues, outdoor venues, safety for your staff, safety for your docents or volunteers. A lot of volunteers are in a protected category, which is older or with additional health concerns. Will they come back? How can you operate without their help? We know they're vitally important to you. We're also in hot weather. We're over 100 degrees. So in trying to have people come to your venues, having them wait outside is not going to work if you're doing screenings or temperature screenings. So are we doing pre-sale of tickets? If you're not set up for that, how do you do that? And how will the public feel? Are they ready to come back? Just because you've gone through a protocol, you're ready to open your doors, is the public ready? How are you going to communicate their safety concerns and what you've done? We've had a variety, as you can imagine, of the input from the public. Some say we're ready to go, open the doors, we'll be back. Others are saying we don't feel comfortable. We want to see posted protocol for both the staff and the visitors. So some venues are looking at one-way pre-sale tickets, where you used to be able to freely roam throughout a facility. You're now going to be in a one-way path. There may be timed tickets where your entry to the event is good for 2 hours. And then as people exit, more people come in. They're looking at staff protocol and cleaning. So will you mask your staff? Will you have, what kind of protocol for your staff? Temperature checks? What kind of posting will you have? Plants and animals. Those who have plants and animals need to have a protocol. How are you going to take care of those? Will people be able to touch, or will it become more of a guided tour where people have to move along? They're not, unfortunately, able to have the interaction that they had before. Those are just some of the things that are coming up. We're also working on opening a slow roll. So if people feel comfortable to go ahead and open, certainly there are other venues that have said, we don't feel comfortable. We don't think we'll have enough volunteers. We're in the season that's most difficult for us, July, August, September. We may wait. Financially, it may not make sense for us to wait. Or it may make sense for us to wait and then come back in September when we feel there'll be more people. For venues that have restaurants or food within them, they certainly have another list of criteria they need to handle for food handling. Do self-service portions of the restaurant go away? Is everything pre-measured, pre-packaged, or will you have the ability to be able to do that? And lastly, you know, the concern also of we've been down for so long. I don't have in my budget PPE, so I've been spending money on that if I try to come back. And how do I advertise? I'm decimated now and I have no money to advertise and let people know I'm there. So we're looking at all of that criteria, all of those challenges. You guys are troopers. Everyone is setting up a return to business plan, looking at their financials, talking to their staff, talking to their volunteers. And it's difficult because it's a daily or weekly change. When is the time right? When can I do it financially? Those are just some of the things that we're dealing with. But the input from operators is so important to us. This isn't a decision that's going to be top down. It's going to be bottom up and saying, what do you feel comfortable with? What works for you? Someone else may feel they're ready to go, or people are looking at phasing in. I'm going to open very slowly with this first. I'll see how that goes. Then I'm going to move to the next one. So we appreciate all your effort and your patience. This is something we never imagined having to go through, and we're trying to send a direct and consistent message, but we also realize there's a plethora of information out there. We're getting a lot of questions on, here's what I'm reading, is this correct? What does that do for Arizona? What about the state? What about the county? We're trying to coordinate all that for you. So please let us know if you have questions. Please watch the task force that are online. Again, you may find some valuable information, or you may find a contact that you say, you know what, I'm going to reach out to them. Sounds like they have some of the same challenges or issues I have, and I want to communicate with them and see where they've found useful resources.
Yes, thank you, Diane. I appreciate your thoughts, and we do have a couple of questions that are being listed on the chat room. And the first one was, and this could be to Aaron, what are the latest trends of the virus in Arizona?
That would be an Aaron question.
Yes.
Sure. So I'm actually going to try and share my screen really quick. I'm hoping that everybody can see this. I'm on the Arizona Department of Health Services website. This is the place where most of our information is coming from, as far as those statistics. The couple of things that I would encourage folks to key in on, if anything, is the stuff that's in the phase 1 criteria, and that is cases by day. It's also got deaths over time, and we're also looking at the one that I wanted to show is going to be what they're calling COVID-like illness, just like the way that we describe influenza-like illness every year. They're also tracking what is called what they're calling COVID-like illness. And so you can find a lot of data on this website. This is, like I said, the COVID cases by day. This is not working for me on this little computer here. And if you click on the county that you're interested in, it'll actually repopulate some of that information for you. And so as you can see, it'll give you the daily trends. Generally, when looking at this information, and we're trying to keep a track of it on the phase 1 criteria document that's on our website, we are seeing a decrease in symptomatic cases and a decrease in deaths reported over the last couple of weeks, which is fantastic. Again, one thing that can be complicating with looking at this data in these sorts of epi-curve style is the last week or so of data is not necessarily complete. We're tracking this information real time as quickly as it can go out. And so it can be really challenging, especially over that 7-day period, to make sure that that is an accurate representation. So these charts will change over time. For example, the way that death data is reported, when we track it on this sort of graph, it's tracked on the date of the death, not the date that it was reported. And so that means that, you know, if that happened 4 or 5 days ago, the number that you saw yesterday for that date will have changed once that gets reported. And so that's how we're kind of keeping track of these trends. There's actually links to some of these pages on our website as well. Like I said, this is the statewide COVID-like illness. And you can see that there is some movement on that graph from that early spike towards the end of March. I hope that can help to answer the question. You know.
Yes, Aaron, thank you. And just for all of the folks that are listening in, we will send over to you a list of all of the speakers and any resources and their links that were discussed today. There is one, Diane, there was a couple of people that joined late, and the question was, and I apologize for asking you to do this, but because you had such a nice talk, but they were wondering if you could kind of give a 1-minute scenario or summary of the key points that you talked about in your talk, because they didn't join in until now, and they were looking forward to hearing you.
Probably, I would love to say yes, I can wrap it up in 1 minute and then go to lunch. Can't do it.
Okay.
Probably the best way to get the information that they need is if you go to Pima County Facebook page. They've recorded all the task force that we have. You want to look for the attractions recording, and they can play it again, and you can see everyone who spoke. Plus, we have comments that were sent in to us by both the public, people on the committee, and then we're getting private, just general information. When we compile all of those, we'll be releasing those so you can see what some of the questions and concerns both operators and the public had. And that's really the best way to get a comprehensive look at what's there.
Thank you. There is a question for you, Diane. When you say some want to open, some don't, do you have a percentage of these folks? Is there a majority opinion?
I would say, I don't have a listing of, you know, there are 62 and here's the percentage. What I would say is the majority we're hearing from people we're anxious to open and get back to business, but we're cautious because they're hearing from their donors, their volunteers, and people that go to that facility we have questions. What are the safety protocols? What can we inspect when we go there? Because it sounds like it's going to be different. And in almost every case, it will be different. So they're waiting to go. Those that have restaurants, some have already opened very limited with their staff, and they're seeing how that goes with restaurant delivery. So people could come in, do pickup and go. Others are saying, doesn't make sense for us because we're a large scale event. We operate on massive numbers, and under the governor's executive order, that still isn't allowed. You know, you can't open up the facility and have 200 people. Can you do it in phases with a plan? Yes, you can.
Great. Thank you very much, Diane. Appreciate
You bet.
that. So a couple of housekeeping for those that have joined us. Please mute your audio and turn off your video if you have it turned on. That way the panelists will be fully focused on your screen. We are recording, I would say, the majority of this webinar. There are a section or two that won't be on there for panelists that have asked for them not to be recorded. But the entire webinar will be summarized by me, and again sent to you all tomorrow, along with all the information, including the Pima County Facebook page that Diane just mentioned, because that's going to be a great resource where you're hearing from your peers and your other industry specialists. There are some plans that are out there right now, in particular retail and restaurants that have been vetted by the governor's office and by the industry. But again, there will be specific recommendations that are going to come out of the Back to Business task force forthcoming. And I guess what Diane is saying, correct me if I'm wrong, Diane, you can get a preview of some of those discussions by going to the Pima County Facebook.
All of the task force that have been held were recorded, and they're all on Facebook in their entirety. And you can also see all the comments. So you can go to Pima County Facebook page and pick and choose which of those recordings you want to watch in the comments.
Great. And we'll also provide a link to that on the SAAA Facebook page as well. So thank you, Diane. Wonderful information. We're going to continue to keep this a little local before we go national. So hang in there, panelists from the rest of the world. And we're going to move on to Mary Rittman, who's the Vice President of Communications and Tourism. And she's going to talk, specifically to that consumer confidence that Diane touched on. Is, it's one thing opening and following all the recommendations, but how do you communicate to to the folks that are used to visiting you, but are a little bit hesitant? I think the governor said it well in his last press conference when he indicated that he thought there was 3 types of folks. There's 30% out there that they're not going to do anything. They're not going to come out of their houses until there's a vaccine or some real assurity that they're not going to be able to get the virus. There's 30% that are raring to go, and they're enthusiastic, and they want to get back to work, and they want to get back to their lives. And then there's that 40% that really is waiting for more information to feel safe, to venture out, to get their lives back to normal. And we've run these statistics by several of the experts, and it's pretty close, I think. And we've done a survey from our attractions as well, and that will be shared by Laura later on in the conversation. And those, it seems to be pretty darn close, that you have a really a mix of folks that are ready, but they're not quite ready. And that's why all of these Back to Business task force and all of the health department discussions and everything are going to do their best to assure that when folks are ready to return to the attractions, that we're going to do our best to make sure everybody is safe. Mary, you're up.
Good morning, everyone. Thanks for having me here, Tom. I appreciate the opportunity. It's good to see everyone, or at least your names on a screen. We're so thrilled that Erin and Diane and their groups are leading this with guidelines and input. Visit Tucson is definitely a part of these committees and subcommittees, both locally as well as statewide and even nationally. And that's part of the challenge, right? Is everyone has different guidelines. So you as your business may adopt a certain set of guidelines. The state will adopt guidelines. Pima County may have some, they at this point cannot be more restrictive than the state, but they may have some recommendations. And people are coming from other communities and other states. And so everybody has different guidelines. And as you mentioned, Tom, everyone has a different comfort level. So some people, if they see people wearing masks, they'll feel more comfortable. Other people won't even think twice if they don't see people in a mask. So the key to this will be communicating to your constituents, your stakeholders, your visitors, what your guidelines are. Just yesterday, I received a press release, and please, if you have them, send them all to us, from the Flores Concept Groups with their 100-point plan for reopening. It seems extensive, but there are people who might be very interested in reading through a 100-point plan. So you can get this information out on your website, through press releases, on your social media. A lot of people are they're not just looking to social media because they're home. We actually tracked our highest engagement last month, but they're looking for inspiration. They're looking for information. So don't feel like if you've put it on your website that's enough. Make sure you're doing it on social as well. If you have the bandwidth, if you have a database of your visitors and consumers, send it out to them as well. For those people who aren't interested in the information, they'll probably just glance through it and carry on. But for those people who are maybe more vulnerable or more concerned or live with someone who's more vulnerable, they're going to pay a lot closer of attention. So whatever your business guidelines are, I would encourage you to definitely outline those. I think here in Southern Arizona, we're very lucky, right? We're a place, we kind of forget this because we live here and we take our beautiful landscapes and public lands for granted. But when you talk to people in other communities, social distancing comes naturally here. Our population density is very much less than what you have in New York, than what you see in European cities. We're actually getting requests for our visitor guides. We continue to get them, not as many as before, but people have noted that they're looking to move. Obviously we've all learned that we can work from home productively, and people are interested in living in a place where the population density is lower, where we're known for wellness. So I think this is going to serve us very well as tourism starts to reopen. Visit Tucson and the SAAA group and some specific attractions have really taken a lead on developing the virtual Tucson.org website. As everyone started shutting down and you realized, you have no way to connect with your audience, it became a virtual audience. So we have a web page developed for that. We're collecting and aggregating social content. Things that happen on social tend to be best served up on social. So a Facebook video, we can't show it anywhere but Facebook. So we have an aggregator that shares that content in a meaningful way. We're posting virtual events on our calendar. What we have seen is that in other continents, so in Asia where they're ahead of us, is those attractions, those businesses that had a strong and growing social presence did better after they opened because people felt that familiarity and comfort. So keep your social game going, even once you reopen, because not everybody's going to come back at the same time. Also, as things start to reopen, we at Visit Tucson have paused our marketing efforts. We're continuing to, do some paid search. If somebody is actually searching for Tucson hotels, we want to make sure those are served up. But we've paused most of our major marketing efforts. Social, as I mentioned, has picked up strongly, and that's without a paid boost behind it. And as things start to open back up, research is showing that it's going to open up first locally. We've not until now, in these unprecedented times, thought about ensuring that locals are going to restaurants. And that's what it's going to take first, is getting the locals out to the restaurants, getting the locals back to your attractions. People, we're finally seeing, I'm getting weekly research, a consumer sentiment for travel behavior in the US. We're finally starting to see the tide turn, where people are thinking about travel again, and they're becoming a little bit more open to the idea of traveling. But what are they going to do first? They're going to visit their friends and family. Many, you know, I'm picking up my mother this weekend for Mother's Day. We've been fairly open with our ability to visit our friends and family, but other destinations, not as much. So that's what they're looking forward to. And they're going to drive. They're going to drive further than they are accustomed to driving. Nonstop flights will pick up after that. So it's going to be sort of a rollout even once the travel starts. So consider promoting locally, even if you haven't before. We're going to be pushing out. The expectation will be that there will be some travel deals. So it's up to you to make that decision, but don't consider travel deals only as to be financial deals, but also look at some exclusivity deals. You all have, you know, we're looking at small groups potentially to begin with anyhow. You all have some amazing behind the scenes opportunities. Think about deals that offer an experience that not everyone has access to. Not just, you know, X% off admission rates. So we will be, once things start to open again, that's when we'll relaunch our marketing efforts, and there will be an emphasis, especially because it will be hopefully summer season, and that is the time where we promote regionally anyhow. We're promoting staycations, not just to Tucsonans, but also to Phoenicians and people from Los Angeles. These are the drive markets. Hermosillo is a very important, Sonora is a very important drive market for us. Until the border reopens, that, you know, that looks a little bit different. So keep all of these things in mind, and know that, you know, if you have an event coming up, let's get it on our calendar. If you have a virtual content, make sure you're hashtagging it Virtual Tucson, so that we can pick up those events, and it will be really important to 60 or 70%, probably there is that 30% of people who are just going to go out and do it, but then those other people who really want to see what your guidelines are and what steps you're taking. We're going through this ourselves with our office as we reopen. We're in a Pima County building, but you know, talking to the staff, getting their input, and how does that look. So I'm happy to answer any questions, because I do have another meeting this morning.
Mary, you're going to stay with us for just a few more minutes. So if
Sure.
there's any questions that come up, there is one real quick one before we move on to Bob. I'm hoping Aaron or Diane is still on, regarding, do we have any idea when the pools are going to reopen?
In Southern Arizona, this is a critical issue. We do not know yet. The governor has a call tomorrow afternoon that we'll be participating in, and we're hoping for some guidance on that issue. It will be difficult to promote staycations without a pool, especially when the temperatures are 100 degrees. So I know that Brent has raised this issue with the Arizona Office of Tourism in some of the committees he's on as well. It's a critical issue for our community, and really all of Southern Arizona. So hopefully we'll get guidance very soon.
So Mary, is your pool open?
At my house, yes.
All right, Mary's email is, no.
Yeah.
My pool's open.
We can only take 4 people at a time.
Well, thank you, Mary. And I know you're going to stay on just for a few more minutes. So
Sure.
If anything comes up, I'll let you know. So we have a very unique gentleman who's been in the government for, I think he mentioned 4 different positions over the years. I may be wrong, but I think I remember hearing that, 4 different agencies. He has recently taken over as the Arizona State Parks and Trails Executive Director. We are one of the unique states that kept the state parks open. National parks were tried to stay open, but some of them ended up being closing because of the large assembly areas that exist in some of the national parks. But Bob, well, we have, I know there's not enough time for you to tell us all of the lessons learned, but if you could highlight it for us, because we're, I think, excited, one, that Arizona State Parks and Trails has stayed open. And as I mentioned in a recent webinar, that it was a pleasure when folks would call and ask me what was open, I could guide them to the Arizona State Parks. And we have quite a few here in Southern Arizona and across the strait. So Bob, you're up.
Tom, thank you. And I really appreciate this opportunity to talk to you all. This is the first time I've met with the Alliance and others. And I think, you know, from my perspective, that I remember, I've been in this state for well over 25 years, and I remember the sayings about how state parks are economic engines, and I don't care. I believe they're important, but I also believe we're a tooth in the gear, that a lot of what you all provide are additional teeth in that engine. And I'll get to sort of a lesson learned that Tom brought up earlier from the early COVID-19 closures. And so I really appreciate this, that yes, we have been open. The governor has kept, and there's 2 consecutive executive orders, is that outdoor recreation is important and it's an essential service. But that doesn't mean that we are operating like nothing's happened. I mean, we've closed, completely closed our historical parks. We've closed group and Ramada-based tours or gatherings, Karchner Caverns, of course, being the biggest. And we're starting to see, well, what does that mean when you talk about a moist and relatively warm environment? What does that do for this virus? So we essentially scaled way back on a lot of those things. We kept it with a broad brush. If I were to paint it, is trails, bicycle trails, some level of RV camping is available, but we've been running at a reduced capacity. I can tell you very early on in the COVID-19 outbreak, and this is, I think, a point that I wanted to make sure I circle back on, is working with all of you to reopen should have been the approach we used when they started closing. Because we were not only affected by a lot of the local areas, but other states. New Mexico, California were one of the first to essentially close the state down. Parks, outdoor recreation, all of those things. And what had happened was essentially you squeezed the balloon and the bubble came to Arizona. And one perfect example was the recreational vehicle industry. That when those places started to close, when parks started to close down and other places for RVers, little did a lot of people know is that there are 1 million Americans who utilize their recreational vehicle as their primary residence. And those folks had nowhere to go. And I attribute, it kind of equated to being ships at sea with all of the harbors are closed. And these folks had nowhere where they could shelter in place. And so what we saw, Arizona, was an influx that started to come into Arizona, and we also had to manage that. We weren't coordinated across the country, and when those decisions were made, it had an effect on Arizona, positive or negative, depending on where you were. But I think a reopen should be the very similar case. And if you know, and I've heard from Diane and Mary and others who've been talking about coordinated, consistent, and direct message is essential. We have to be essential. Our folks, yeah, we've seen folks that come and visit our state parks, but they're not doing that as necessarily. Most people are not doing this as sole source sort of destination. They go, they visit, and they leave, and they come home. They are visiting the Desert Museum, or they are visiting other attractions in Tucson. So I think as we all start standing back up, we all have to start standing back up together. But I think a real lesson to learn on that was how we started closing down. It wasn't coordinated. Within our own state is not coordinated. We've got federal, other state, and local land management and recreation management agencies that we're trying to make sure that we were being coordinated. And when we sit on a weekly call with all of the city and county parks and recreation directors, and we start talking about how we're going to close or how we're going to implement best management practices, and it's allowed us to share. Tom's right. Since day one, our parks have been open. Our staff have been employed, and our staff essentially don't need to take anything from the healthcare workers, but have been on the front lines. They have been out and interacting with the public using protective measures and others for just over 50 days now. And I can say with confidence and also joy is that we have yet to have one COVID-19 positive staff member come back. So I think that's really good, but it's really to focus on how we really ramped up and changed really our business approach. The effort that was mentioned earlier with the Arizona Office of Tourism, this is where Tom and I met virtually, and he then invited me after this, as he's part of that group as well. And we're looking at ways to bolster tourism through a statewide coordinated effort. I think it's probably going to focus on Arizona residents. I think we can all say with some confidence the international and somewhat national travelers are probably not going to be our honey hole here now that we're starting to move into the summer months. So we're going to start looking at messaging and approach and how we're going to connect with our folks and say, you know what, we're open, and really raising all boats is really the goal here. Direct and consistent messaging, absolutely. Our folks, they want to make sure that it's safe when people come to our park. Tom's right, that restaurant, look at 30% are going to do it regardless, 30% are not going to do it till there's a vaccine, and then there's that 40% that are out there. I think that's just anecdotally and looking at some numbers, and I'm certainly no statistician, but I think that's probably pretty consistent with what we're seeing. We're seeing in our annual pass sales, a spike in annual pass sales, but a decrease in visitation. And we've done that to curb the capacity. So these are some new folks that are coming in. It's strong. Most of our parks, that if they're not under some massive heat warning right now, we're having to turn people away. We're having to start really close because it's the social distancing guidelines that we're trying to achieve, but we're locking gates, and until there is a family group, then we'll let them in. But as you know, most people won't stand out in the heat waiting to come in. But that point made earlier. So I think there's a strong cadre of folks that are out there that are ready to start coming back pretty strong. We're also seeing is how are our messages being delivered and by whom, and we've really been tracking a lot of misinformation. There are some from journalists also, but these are the chat rooms and the groups. These are the folks, a lot of the folks who don't know the difference between a national park, a state park, and a local city park. Those folks have always been there, and we really try to jump into those things like, chat groups on Facebook or groups or friends groups, Nextdoor app, this and the neighborhood apps, and people are asking what's open, and we're trying to just drop tidbits in there, either links to websites or our staff. I've got 250 people in my agency. I wanted them all to be marketers right now. Let's make sure that people are getting that information there.
Right.
The other piece too is that I think was really unique. It separates state parks from a lot of the federal agencies who have gone to full campground closures or recreational closures. is that we have staff and we have several points of contact, but there are two main ones. They could, as they're coming in the gate, we can talk to them, educate them, explain to them that we are not business as usual. The second is we have park rangers that are in the park that can really strictly enforce what those regulations are. And we've run into a lot of those folks. You see them on the news, for example, but for the most part, 98% of them just want to know, what can I do and how can I be safe? And that gets to me to another point that can't be lost in this discussion, is the personal responsibility of our folks, that we're really trying to educate them. Is, you know, if it's wearing masks and being clean and doing these types of things, that not just in our park, but when you go home, you'd be amazed how many people haven't even heard of the Department of Health Services or county officials that are trying to get them information. So really that contact has been much broader than just park, but take this stuff home. And so we really try to also emphasize that there is some personal responsibility here, and some mistakes that are made by individuals could ruin it for the rest of us. And there's always that one apple in the barrel. So it's been an interesting journey. If I were to summarize some of the main points here, I think the lesson learned in the close downs of states, we should not be employing that sort of haphazard or one-off or separate and individual type decisions. That we are all in this together. When you talk about tourism and attraction-based tourism, we are right in there with you. And we want to be in there with you as you start to open. And that messaging is absolutely going to be critical. There's going to be the new normal. And I think we can get a pretty good idea of what that's going to look like. But we all have to be similar. We can't have people, for example, in my parks, I can't have one park that's strictly enforcing CDC guidelines and another one that isn't. Because one, it's not the consistent message. The other is we have got to reopen, folks, because there are parts of this state where there is natural resource damage that is going on from people where the unmanaged lands, but also that they are going outside and they are going to go recreate, and they're going to camp, and they're going to use nature as the bathroom. And that then leads to other issues like wildland fires and those types of things. We are seeing it, and closing down is not going to close down the visitation and the use of the outdoors. And we've always looked at it as more of a hands-on. We can manage people. Let's manage these people. So that would be kind of my lessons to you all. I really appreciate, Tom, the invite and hearing from you all as experts in your industry, and see how we can work together on reopening the state.
Thank you, Bob. Arizona State Parks has been a partner from the inception of the SAAA back 22 years when we started this organization. One of our unique characteristics was to have all the state parks included in our marketing, and because we are an outdoor arena, Tucson and the Southern Arizona and state parks have been a vital part of our recreation. When we went through some closing of the state parks, that was a tough time for all of us, but the communities came forward, and most of those state parks, if not all of them, stayed open. And now I think they're all pretty much under your administration now. Maybe there may be one or two partnership parks, but we appreciate your leadership, and especially your superintendents that are out there in the community every day. Thank you, Bob. So we're going to continue. We have two more local speakers, and then we're going to go national, because again, over half, maybe 30, I think I heard, are starting to open, and the people that are coming up after Amber and Kate are the ones that really know what's going on nationally. And I think it's important that we understand what's going on nationally and some of the lessons they have learned. Some of the states are a little bit ahead of Arizona, and so there's clearly lessons learned there that we want the national folks to make sure you get an opportunity to mention that. So Amber Smith is up. She's the president and CEO of the Tucson Metro Chamber. She is also a member of the Southern Arizona Attractions Alliance. And a while back, we reached out to the Tucson Metro Chamber. We hope that one day they'll all be members of the Tucson Metro Chamber, but some are in Southern Arizona, so they belong to other chambers. Chambers have been a very vital part of our membership as well. They actually, especially in the rural counties, act as the DMOs of those particular attractions. So we've started off partnering with all of the rural chambers, and then Tucson Metro Chamber came back on board under Amber's leadership. So Amber and the SAAA have been working very closely together on related COVID-19 opportunities, but really not our expertise, but the chamber's expertise. So Amber, is your video on?
It is.
Okay, there you are. All righty. I like your background.
Girl can dream.
Yes, go ahead, Amber.
All right. Good morning, everyone. Thank you for having me. Tom created quite a large brush there of things for us to cover, and I will do my very best and happy to answer any questions. First, when COVID-19 started to really impact our local community, we all remember that week of March 16th when nearly all of us were either already working remotely or moving to work remotely. Our team did the same thing. While at that same time that we did that, we also launched a community website, tucsonchamber.org/COVID-19. We quickly created a community guide and different topics. We met with our business and community partners as well, from the Community Foundation to Rio Nuevo to our partner chambers, Better Business Bureau, you name it. We reached out to all of our partners and said, would you like to be a part of this website? We felt, we collectively, the business community, felt it was important to have just one location for businesses to identify resources, because that information, much like it still is, was coming fast and furiously, and people didn't know which way to turn, what information to believe, was it credible, et cetera. And so we chose to lead that effort to provide that credible information that was also relevant and timely. So that was the first thing that we did as part of COVID-19. Secondarily, the chamber's job is to make connections. So we provided those resources, but then we wanted to make sure to connect folks personally to those. I see that on your agenda you have some of our strong partners. My board chair, Tim Medcoff, is on here and he'll be speaking to you later. But we also have some folks from Crest Insurance that have also been instrumental in showing some leadership during this time and offering services. Both groups have actively been putting on Knowledge at Noon. We've been trying to hold them just about every single day on specific topics, such as the one that Tim will present on later, all the way to let's have a virtual happy hour to kind of lighten it up. We know that there are so many different issues that businesses are going through. Like right now, you probably hear my background noise. I'm working from my dining room table with 3 children and a husband all around here, all of us trying to either do school work, do our professional work, and then keep our sanity all at the same time. So we started to try to create that programming as well to open to even non-members. I mean, Tom said, of course, we want everyone to be a member because we have our own organization to sustain. But more importantly, we know that we're the largest chamber. We need to provide those resources, whether you're a member or not. And so we've been opening up all of these benefits, near and far, to where we even had folks out of state going to our website to retrieve resources. Since then, we've also called every single one of our members to find out what exactly are they experiencing. And we had 2 things rose to the top. One, cash flow. We all know that one, which is why PPP and other efforts were put in place by our government. But then secondarily, Morale. Morale has been a very, very challenging issue inside those businesses. Whether it is that business owner who is complete life is their business, all of their personal financial investments, to those that are concerned about getting the illness or the impact on employees or their own family members. And so those are the things that we've started to tackle immediately. Through those calls, we've been making follow-up calls now that we're, about, well over a month into all of this to say, what are you experiencing? And Mary raised the comment earlier, and it was alluded to that there are businesses that are just not ready to open. We don't have that data and statistics either. I am the chair of the county's task force on employer and employee, both health and economic wellness. And we talked about this, that restaurants, many of them are not prepared to open. Some of it's because they don't have PPE, or their staff is not comfortable coming in, or, like someone said, they can't sell the number of volume that they need to for their own sustainability. And I don't have a statistic as to how many businesses are feeling that way, but we do have a restaurant advisory council, and our RAC of restaurants have communicated that. Restaurants have communicated that they don't know how to open. We have the standards from the county, and that's who we've been watching as well, is we want everyone to abide by those standards. But then what does that look like for them? How do they set their tables up? The county has been great in recognizing when there's been certain asks, like extension of premise, because businesses have to get creative and be able to extend their services onto the sidewalk, into the parking lot, et cetera. And yet we still want to maintain right-of-way safe environment as well. And so the county is working with us on that issue. So we are working with our government officials to try to figure out creative ways to be able to address these health concerns, to achieve that distancing. Things like showing technology that can be helpful for touch-free use, introducing one-use items, microbial, I completely butchered that word, pens, different things like that to really try to get businesses the tools that they need to feel comfortable to open. We will be launching a survey later today to try to get those numbers that Mary's getting at. It will be quick and dirty, but I think that it will at least create some sort of gauge as to where our business is. These announcements of openings have been coming pretty fast and furious, and I don't think that we've really had the time to be able to assess the lay of the land on that. So now what we're going to be working on are those different guidelines. Taking what the county and the state have released for those guidelines, putting it in a step-by-step process as to what would make sense for your employees, how to prepare your floor space, COVID, reducing your touch points, that type of thing. And so we've prepared retail, restaurant, and office right now. We will be releasing that out into the community in the next day or two. We are creating what we are calling a kickstart your marketing plan, offering some packaged advertising opportunities in partnership with Cox Media, so that people who are able to take some of those funds can then utilize them and announce that they are open. We have a ribbon cutting effort that we are going to be doing that's going to be showing, hey, you'll have a sign that says we're back in business, just so that we can really get that word out. It's going to take more than gift cards and Yelp reviews, which are all incredibly important and have really helped us get to this point. But what happens in the next 30 days is going to be critical for those businesses. 95% of the chamber membership are small businesses. 99% within Tucson are small businesses. And so we are genuinely in absolute crisis mode. What we can say is there's been a lot of positive things that we've seen as well. It's been a good opportunity to see how companies are innovating, pivoting, recognizing that they need to be more flexible. And one company testimonial that I heard, a large manufacturing company said, I never, ever, ever in a million years would have advocated to have offsite work for my employees. I never would have advocated for it because one, I thought it wasn't a good idea, and two, I didn't think we would actually be able to achieve it. And now we have shown that not only were we able to quickly get in that position and do that, but it's worked very well for our company. And so it is forcing some innovation in some positive ways that were unexpected, and yet challenging all at the same time. So that's what our role is we are going to be having a bit of a mentorship that we are going to build to work with those small businesses. We'll bring forth some of our key innovators on our board and within our membership that can work with small businesses and say, this is how you can retool. Here are some ideas. Again, we are that connector of those resources, that information, that expertise, and we will continue to offer that to the best of our ability while advocating. I mean, the number one mission of the chamber is advocacy, whether it is advocating for those businesses to survive and thrive, or to advocate for policies that address that as well. So we're looking at ways to reduce regulation. Sign code, we jumped in very quickly on that one to be able to reduce sign code fees and regulatory barriers, A-frame signs, things like that that are affordable that these businesses have been precluded from being able to use. The extension of premise is another one. Going to the liquor board as well, that's really is willing to work with us on some things. Yes, Tom.
1 more minute, Amber.
Yeah, just about done.
Okay.
And so we have weekly meetings as well with our congressional delegation, talking about PPP, talking about, what else can they do? What, EOC policies are out there that need to be updated and changed, because that's a good opportunity as well to deregulate some things that have been hindrances. Overtime policies is one of them, as a matter of fact, to where we have some employees that want to work overtime, but the employer can't afford that time and a half. So we want to be able to see what some of those unintended consequences are, work with them and address them, and lead the charge on that in collaboration with some of our partners in the community. Happy to take any questions.
Okay, so if you have any questions, please fill out on the chat area. And Amber, I just wanted to help you close that you are morphing into helping the small businesses actually understand the recommendations and develop their own plans. Is that correct?
That's right.
So we have been recommending to listen to all the Tucson Metro Chamber webinars and I think you have them every noon, don't you still?
I'm not sure if it's every single day now, but it's pretty common. And then after we have them, they do go up on our website, as well as other entities' websites, or other entities go on our website as well.
So again, we'll make sure Tucson Metro Chamber is on the resource list that you will all get tomorrow. And we really appreciate the Chamber extending their benefits to all of our members. And if the members that are on here do not know that, please go to Tucson Metro Chamber. There's a plethora of information. All of the webinars have been recorded, as I understand, and available to you. They've helped a lot of people get PPP loans. We're a 501c6, so keep working on that, Amber, because you are too. So we could use a little bit of money as well to keep these resources going. So our final local speaker is very involved in the arts and cultural area and has a lot of background information about how museums are reacting to the COVID-19 in the process of developing their reopening plans, because they are obviously very unique in the sense that most of them are indoor, small, confined spaces. So their difficulty of social distancing may be a little more challenging than others, while still trying to maintain some kind of interactive approach to where museums have gone over the last decade. So Kate, I hope you're still on, and take it away.
Definitely. Thank you, Tom. I apologize. I will be brief. I've got to present at 10 a.m. on a national webinar, so I'll run quickly. And if anyone wants to contact me afterwards, you can just email me directly at kate@saaca.org, and I can provide you with any of the brief things I'm going to talk about. But when Tom invited me to be a part of this, he wanted me to touch on a little bit of the process of how our organization has made decisions. As many of you know, we are an organization with now both external programs and internal programs. A lot of people know us for our larger scale festivals and events. We produce over 150 of them each year. But over the last 3 months, we had invested largely in a 14,000 square foot maker and art space at the Tucson Mall. So all of that, of course, came to a halt in mid-March. Over the last 45 days, we've seen over 600 artist opportunities that were directly involved through our festivals, events, and through Catalyst come to kind of a screeching halt. Most of those are independent contractors or artists that participate in our events and are able to raise money. So we took our immediate focus to the local level and saying, how do we service our community partners and utilize the arts as an impact method? So initially, of course, with beyond the scrambling of just canceling events, and of course the communication strategy and decision making with all of our regional partners to decide whether to cancel, postpone, or delay any of those events was our first method. But we also quickly responded with working on employee development programs. Of course, a lot of our business partners are looking for creative solutions to activate their employee bases. So we launched in partnership with Roshi, as well as several other employee sites, some creative arts programming. We also upended an arts care package program. We've been able to provide just in the last 3 weeks over 500 seniors living in assisted living communities with these packages. And along with a whole host of other virtual offerings and digital concerts. But how we really have emerged now is next week we will be reopening the Catalyst Arts and Makerspace in a phased capacity. And we're happy to provide anyone. We should have the final draft of that today with a copy of that. We are taking a very conservative approach to reopening our space for scheduled events only through the end of June and possibly beyond. But that phased reopening plan will really be guided by collaboration and working with all of those artists, creatives, and makers that really are kind of synonymous with our organization. When it comes to our external programs, that was a bigger immediate task for us to start really focusing on. So how do we make decisions for the next 12 months of those 100+ large-scale festivals and concerts that bring in audiences of 1,000 to 35,000 here in Southern Arizona and beyond? So what we have started to engage in is a full-scale feasibility effort that does, on a about 25-point approach, reassess every single one of our external festivals and events, looking for new layouts, new options that are, considering public health and knowing that there's a lot of decisions that we can't make today, but we're working with our partners pretty hastily on making amendments and coming up with new innovative ways to deliver arts and culture to Southern Arizona in a safe and engaging and a new way. So that feasibility study that we have in a guided format, we're happy to share with anyone also who is also grappling with how do you make decisions on the future for a lot of these large gatherings. So we're also engaged at the national level pretty heavily with Americans for the Arts. In mid-June, we also are going to be continuing to host the Southern Arizona Momentum Creative Sector Summit. We are going to launch this completely digital. This will host about 40 to 50 different webinars and online sessions that will be completely dedicated to ideation of how we move forward. We know that that is going to base 100% in creative solutions, and we know that we have to put artists, creatives, and makers at the center of those decision-making strategies. So that is where my major update on SAAA and where we're at. Like I said, I'm happy to share any of this documentation or our decision-making process with anybody in the SAAA group.
Kate, so I know last time we talked that you mentioned that a week ago you weren't seeing any reopening plans, and then now all of a sudden, because the governors are starting to reopen their states, all of these best practices are starting to filter through the internet. So is it possible for you to forward the links or everything to me, and then I'll make sure those get out to everybody? Obviously, they're all using national best practices initially, and then they go into their own particular business segment. But I think it's great for us to see those the museum ones and some of the other ones that you shared with me the other day.
Definitely, and I would encourage everyone to go also to Americans to the Arts, because they are really the leader in these efforts, as well as WESTAF, which is the Western Arts Federation. They are providing a lot of these resources to our organization as well as organizations, and really delivering information in real time. So sometimes we're not even, depending on the time difference, as updated, but I would encourage everyone to go to Americans for the Arts website, because they have the most comprehensive list of that, and that's where we're getting a lot of our direction and information.
Thank you, Kate, for joining us. I know there's a 10 o'clock one webinar that's starting pretty soon on the restaurant associations and so on. So we really appreciate you getting on, and then I'll be sure again to everyone on their computers that we will forward those websites back to you as well, so you can look and learn and from some of the other folks that have maybe they're a week ahead or so of us. So thank you, Kate. So we have concluded the local and regional aspect, and I really want to thank the national folks that are coming on board for your patience. Very difficult for our professional group to talk for only 5 minutes, and I know better than that. I don't think I ever talked 5 minutes on anything. So we have my esteemed pleasure to introduce the International Association of Amusement Parks Vice President of North American Operations. John's got quite a background, and he and I know a lot of the same people. And I think it's important that, again, some states are ahead of us, but the IAAPA has been giving safety and educational advice for decades of, I think I have been going to their major trade show for 40 years now, and John, so that's kind of obviously showing my age here. But John, please spend a few minutes with us on how is IAAPA addressing and helping the membership get reopened.
Hey, Tom, thanks. Really appreciate it. And thanks to the Alliance for having me on to discuss a little bit about this. You know, the plight of Arizonans are not any different than anywhere else in the country and really around the world. And IAAPA is a global association. We have about 6,300 members worldwide. We have 4 different regional offices, one in Brussels, Belgium, one in Hong Kong, one in Mexico City, our Latin American office, and then I'm in Orlando, Florida, as the North America office. I like to refer to it more as the North America office, because I really deal with the US and Canada, because our Latin American office takes care of Mexico. I'm not a very good Spanish speaker, even though I'm here in Florida. So, you know, I try hard, but we really take care of the US and Canada. And in Arizona, we do have 63 members of North America. Our total membership is 3,700 members across North America. So, you know, I really look at IAAPA North America as being the glue to the world in terms of the attractions industry. And we're working very hard right now in light of this COVID-19 situation to try to learn from other regions, take those learnings and apply that maybe to North America a little bit. Also learn from other North Americans and see how we can help each other out. So as I'm hearing a lot of people mentioning about, there are some states that maybe are ahead or behind of others, we're really trying to take the initiative on of being the communication voice for the industry in many ways. And what we're doing is providing a lot of resources. Our IAPA.org website has a full COVID-19 resource section, and that is on the front side of our member wall. So you can actually even not be an IAPA member and take part in utilizing any of those resources. Again, the website is iaapa.org. You can go on there and you can utilize any of the resources that are there. We do have some that are just kind of general resources, and then others that talk more about regions and give maybe some even specific things to the United States. And what we're seeing a lot is, there's a lot of needs from our members out there, both ones that are closed and looking to reopen soon, ones that potentially may not reopen for the season, and unfortunately some that may not reopen at all. So we're trying to just provide as many resources as we can and learning from each other to create connections and communication possibilities. We've just created a guidance document that talks about reopening. It's a 36-page document that goes through various issues and topics. There's general guidance on just overall sanitization. We have health and safety points in there, guest communication and guest responsibility, HR management, physical distancing, face coverings. I mean, it covers the gamut of what everybody is talking about right now. And then it also gets a little bit into the weeds of more of the operational things like restrooms, facilities, rides, attractions, water parks, retail, F&B. It really goes through a lot of different topics and just provides some general language and thoughts as to things people are doing or thinking about when reopening, and providing that as a foundation for people to utilize and create their own individualistic plans. We use this document for a few different reasons. One is to try to educate some of our members to be able to help them create those plans, but then also to advocate for government to be able to let people know that, hey, there is a plan in the attractions industry for reopening, and provide some guidance there so that they understand that maybe we shouldn't be lumped in along with sporting events or concerts, large mass gathering events, that we have a bit more opportunity to be able to control attendance, to control movement, etc. So we really take that document and use that for a lot of different ways. IAPA is very big in the advocacy front, both on a state and a federal level. We've sent multiple letters to government, to Congress, to be able to advocate for various relief packages like the Payroll Protection Program, like the CARES Act, and anything that might be coming further down the road. We have an Advocacy Alert program where people can sign up and very easily just click a button, and that can get information to your local, your state, your federal government officials, and be able to say, hey, here's where we would like to stand in terms of attractions industry. We're seeing a lot of plans coming out from a lot of different states that talk about reopening either in waves or red, yellow, green, or tiers or whatever. And it always seems that the attractions industry is kind of getting lumped into those later tiers. And we're doing a lot of things to try to create just the knowledge base so that government officials can look at it and say, maybe we can bump attractions up a tier and be able to get them started a little bit earlier to be able to, get some more revenue, get attendance going, et cetera. So we're doing a lot of things to advocate for that in the industry, as well as, joining forces with others. We're hearing a lot about we're in it together. We've worked with the U.S. Travel Association, Hotel Lodging, Restaurant Association, other attractions associations like this, others in the region or states around the United States, as well as in Canada. There are a few provincial associations and just working with the government of Canada as well, because they're facing the same considerations that we are in the US. So we do a lot of things on the advocacy front, and we really provide a lot of benefits for our members on a normal time frame. And a lot of those benefits are now being opened up for everybody because, you know, it is an important issue. We do need to get past this. So anything that we do from an IAPA basis, whether it be webinars, education sessions, use of member directory, etc., those are all on the front side of our member wall right now. And we're just doing what we can to try to continue to provide communication, provide advocacy, provide understanding, and a little bit of guidance, you know, to everybody, including those of you from Arizona. So we're trying to do that on a state-by-state basis. You can imagine how hard it probably is in your own individual state to do that times 50 and then add another country in there that, you know, it's definitely a daunting task. I usually have my personal assistant, our gray cat, on this cabinet behind me, but she's decided maybe not to grace everyone's presence today. But working from home has definitely been a challenge, and it's one that, you know, we've done really well with all around the world, and we'll continue to take those learnings and take what we find and provide that as a communication topic to be able to get more information out to everybody to help everybody along the way. So I'm able to stick around for questions at the end, and just really appreciate the time to be able to try to help do what we can to help out the attractions industry.
John, thank you. And as Amber mentioned, so many of the organizations that we are partnering with or members of have opened their benefits to all of our attractions. And because of the diversity, you know, some belong to your complementary organization, the American Zoo Association. And of course, there's a Tucson. I'm sorry, there's a museum association as well. And I know you work with all of these associations. A lot of them are based in Washington, but some are in Orlando, where you're based as well. So just a plethora of resources, but IAPA kind of, pretty much all the zoos belong to IAPA as well, and as well as the aquariums and as well as museums. So IAPA is a great resource, and thank you, John. I really appreciate you being on, and a great, you know, I'm not saying that if you call John, he'll send you the Disneyland reopening plan, but he could probably share some of the strong points that are in the Disneyland plan, unless it's been leaked. And a lot of those plans have been leaked, haven't they, John? So
one thing, Tom, is if you go to iapa.org and in the search field, you just type in reopening guidance, that's where you'll find that document I was mentioning. And that was really a collaboration from many of our you know, members, facilities. Some wished to be listed, some didn't, but you know, there were hundreds of documents and people and other resources we used to put that together. So, you know, it's not something that IAPA just thought up and put out. There was a lot of thinking put into that. And by all means, that's, like I said, a foundation for people to take that and be able to push out a plan or some thoughts on their own to be able to get to government officials or to their staffs to be able to, you know, be ready when we aren't able to get going to, you know, just get ready to hit the ground running.
thank you, John. Again, great resource, and thank you for hanging in there for a few minutes. We're going to change the order a little bit, and Mr. Stone, who's really a national communications PR expert for all levels of tourism, but obviously his background has been in the gardens and in the Opryland, in sponsorship, and Ed and I have known each other for many years, and Ed is still staying in touch while he's vacationing in Florida. Extended vacation, right, Ed?
Yeah.
So Ed, you're up. We got, and then after Ed, Ken is going to come on and kind of bring it home. And then please hang in there, because the guys on the risk management side have been so patient hanging in there, because I think it's important that we have just a small conversation on the risk side of what's going on. And they have also written kind of a plan on how to get your facility open with a little bit of a risk management take, which, as you know, what's going on now, every ambulance chaser is lining up, and there's been lots of discussion about how we all need to protect ourselves as attraction operators. So Ed, from a PR and communication standpoint, you've been listening to everybody. How can you bring all this together for us on instilling consumer confidence?
Tom, thank you for having me on, and I want to say you've done a wonderful job of bringing all these people together. And I'm going to be the most brief presenter today that you'll have on the group. So one of the things I did a little bit of research on is find out that the news consumption over the last 50 some odd days has been up 39%. Social media usage has been up 29%, and online purchasing has been up 28%. Can you hear me?
Yes.
Everybody hear me? Okay, good. Okay, so I wanted to make that just a brief introduction insofar as communications and the public relations standpoint. Social media has obviously become a major influence insofar as communicating to the various different publics. I made a couple of notes here. One is that there's three audiences I think that people need to be aware of. One is the visitors and the potential visitors. Two is the staff, and three are going to be your association members that keeps the whole link together. The thing that I think we need to look at is how do we make sure that we are communicating the right message. The right message being the positive stories, the right message being the things that puts people back into the framework and to the frame of mind of wanting to come back to the attraction. And I think we've got to keep that open. One of the things that I think we need to do insofar as the messages that we're putting out to the potential visitor is I would encourage people not to make that message too urgent. In other words, keep that message out there that when the time comes for you and your family to get outside and visit, when you are looking forward to that special event or that special occasion, as opposed to saying, book now, come on out right now. This is this. Don't make it an urgent message. Make it a message that is, I'm going to say, a relaxing message for people to come and visit your facility. The other thing is, I think you need to look at who are you going to be targeting those messages to. One is obviously going to be to the local market. They're going to be the first people to come and want to get outside and feel comfortable because they know what kind of facility you have, you're local, etc., and they're going to be coming out. The second is going to be that day drive market. That day drive market is going to be the people who are 50 miles or 100 miles out that can come back and not have to have a hotel room and so forth. The third one is going to be that overnight market that will drive in, because I think we're going to see that fly-in market, that people that are coming in from long distances, taking an airline into a Tucson area. It's going to be maybe another 2 months, 3 months, we don't know. The other group is going to be your group businesses. And in my whole experiences, we've always looked to increase that group travel business and getting the group business in. I think you're going to be looking at 6 months to a year before you see that segment of our business really, really starting to show up at the turnstiles. And then, Tom, I think the other thing is, Bob mentioned the positive stories that about taking care of the RV customers who were looking for and didn't have a place to go. There are people, and I have several friends that are that are retired, that live in an RV. They go from one area of the country to the next area of the country, depending on the weather. And those people have got to find a place to go. Putting those success stories out there is going to be one way of keeping a top of the mind awareness to our visitors that are going to be that are pin up. There's a pin up demand out there that is like we've never seen before. And as soon as we can convince the visitor that we are safe to come to, that you are clean, that you're not going to be exposed to the virus, et cetera, you're going to see your business start booming. I'm going to be very brief, as I said, and I don't think I made some notes. I had about a 20-page speech for you, but otherwise I'm gonna
That's my job, Ed, not yours.
I think
In conclusion.
putting it all together is here was my ending. It's never too early to remind potential travelers that you are a great destination and looking forward to hosting the visitors again. But as a trusted brand, we do not want to mislead our audience by going against official recommendations. Thank you very much, sir. And I'll be around for questions.
Thank you, Ed. I really appreciate it. So let's kind of bring it really back to the attractions. And we're not really operators, Ed and I, anymore. We rely on, we used to be operators, and we used to sit where a lot of the listeners sit and hear it from the employees and work with the guests. And when we didn't want to talk to the employees, we went out and visit with the guests, you know, so we were very guest oriented. And I think it's important that you come from a guest orientation, because they're the ones where we have to rebuild this consumer confidence. And of course, give credence and credibility to the government officials who are working 24/7 to really help us make sure we can open, even though it may not feel that way sometimes, but they truly, I believe, want us to reopen and get the dollars churning again, but we don't want to obviously reinfect the folks. Kenneth is going to bring it kind of home, and then we're going to end with the risk folks. And again, risk folks, don't go anywhere. You know, we still have over 30 folks that are on there wanting to understand a little bit about from the risk side. But Ken can, you know, and I know we only got 5-6 minutes for you, but kind of bring it home. What are the people looking for? And more importantly, you're out there and you're available. A little pitch for you. If this task is too daunting, that's why you're around to help out. Go ahead, Ken.
All right, thank you. I appreciate being here and having the opportunity to speak in front of this group. I too was an operator for about 15 years and discovered that I didn't like it. So I discovered that being a consultant was a lot better than being an operator. I got tired of turning in my budgets and having them getting shot down. Now I don't have to worry about anything. I can turn it into my clients, and if they do it, they do it. If they don't, they don't. So I found a consultant being a little bit more pleasing than being an operator. But the operator experience was very good. I spent 15 years, a lot of it with Six Flags, and then I spent time with a small family park. It's not small anymore. It's Dorney Park in Allentown, Pennsylvania, and it has a water park too. In talking with my clients and my friends over the last few days, in particular, I talked to the general manager of Playland in Rye, New York. If you're not familiar where Rye, New York is, it's a few miles north of New Rochelle, New York. And if you've watched the news at all, you'll understand New Rochelle was locked down originally, not really locked down, but it was really the heart of where it started in New York. And so when Frank and I were talking, you know, he said, "How do we do this? How do we reopen? You know, where we get people in here in crowds. How do we control them once they get in the gates?" And I said, I don't know how you control them once you get in the gates. I said, once they're in, they're in. They're going to go like crazy everywhere they want to go. So, you know, then it gets down to how do you retrain everybody in your location? What about new training guidelines? Rethinking how you're going to operate. For example, on a roller coaster, do you fill every other seat? And then when the roller coaster come back, you fill the other seats and you sanitize the seats that were used. Sounds great in theory, but it isn't going to work. You're not going to have enough employees to do that, and you're going to run out of sanitizer and disinfecting sprays in short time. Then you're thinking, well, there's a lot of kids involved. How do you control kids? I was just reading recently that Cedar Fair, who operates a lot of parks across the United States, including Kings Island, which is about 25 miles from me, they're talking about cashless transactions. They're talking about reservation systems before you even get to the park. You reserve a time or you reserve a date to go to the park. Limits on attendance. Now, if you're unfamiliar with a park like Kings Island, for example, on a good Saturday in the summertime, about 4 times a year, they do over 65,000 people in one day. How does social distancing apply to that? So I've been talking with my clients about rethinking how to operate, rethinking how we're going to train our personnel to enforce the social guidelines. Then you get down to the basic things like public restroom cleanings. Now, during my time in this industry, I spent 8 years with an insurance company out of New York, and my responsibility was to inspect all of the family entertainment centers that were insured by that insurance company. So over 8 years, I performed about 1,100 inspections across the United States. And even in the best of times, the bathrooms were probably the worst thing I found in any inspection. So that kind of takes care of that there. Now we're talking about PPE. My business partner said, when I give a seminar, I talk a lot about PPE. Now it's all over the news. She says, everybody knows about personal protection equipment. I said, yeah, but the personal protection equipment I'm talking about are hard hats, safety glasses, earplug, you know, sound, those sorts of things. Now we're talking about face masks and gloves. All your employees are going to have to be equipped with those. And, you know, some of these face masks are one-time use or day use or whatever. I go to the store and I put on these gloves. By the time I get out of the store, my hands are sweating inside the gloves because they don't breathe. One park in Indiana called Holiday World, they have hand sanitizing stations throughout the park. Last time I was there, at each hand sanitizing station, there was about 6 different flavors of hand sanitizer that you could use. It's all free. And the last time I was there was a few years ago, long before this was even thought of. Another thing is, how do you take money from people? I went into a small convenience store yesterday and I reached into my wallet to give the clerk money and I pulled it back in and I used my debit card for a $3.93 purchase because I didn't want to take his money back from him or the change or anything like that. This one park in Indiana has cold drink stations. You just walk up and get your drink. It's all free. Soft drinks, water, whatever you want. Now, of course, they're not giving it away, but it's the impression that they do. If you operate an FEC, you're in a closed confinement. Some of the FECs can range anywhere from 10 to 20,000 square feet. Some of them go up to 70 or 100,000 square feet. A lot of FECs are converted Lowe's or Home Depots that have closed down. I ran into one that was a closed Walmart that had about 130,000 square feet of floor space. All those FECs had buffets. I think the buffets are gone. The people I've talked to are, you know, you're going to eliminate the buffet and go strictly to waiter service, people bringing you your food. Eliminating games throughout the arcade, for example, so you can create social distancing. It's going to cut about half your revenue on the games, but you're going to increase that social distancing in between the games. And then, you know, who's going to enforce the maintaining of it? You know, living here in Cincinnati, we have a nice supermarket called Kroger's, the biggest grocery store operator in the United States. There's people in the Kroger who are reminding people to social distance. You're getting too close to this person or this, whatever. The aisles are all one way. This is in a grocery store. So I think, you know, and I also have a contract with the Louisville Zoo. They're not even close to opening yet. They haven't figured out how to do it. Although the Oklahoma City Zoo is getting ready to open, I think, in another week or so. Right now, the clients and people I work with, Louisville Zoo is closed, Cincinnati Zoo is closed, Kings Island is closed, Coney Island here in Cincinnati is closed, Cedar Point is closed, Playland is closed. My client in Chile, Fantasylandia, they're closed. My client in Bogota, Salitre Machico, is closed. And Holiday World in Indiana is planning to open in early June. And talking with operators, we're all befuddled by the same situation. We have a lot of people in a relatively small space. Now, maybe 100 or 200 acres is not a small space, but when you cram 20, 30,000 people into it, it becomes a relatively small space. So, you know, the top lines, things that we're talking about are rethinking how we're going to train our personnel. How are we going to encourage our personnel to politely tell people to social distance? I know everybody's watched the news over the past, you know, few months, and just from what's seeing at the steps of the Capitol State House is any indication of what's going to happen when we walk into an amusement facility, whether it be a family entertainment center, an amusement park, a carnival, you know, a stock car racing track or horse racing track or anything like that. I think it's going to be kind of difficult to, you know, to maintain. Cashless transactions, reservation systems, and public restroom cleanings are going to be absolutely necessary. My friend at Playland said he doesn't think that when they're open, the people are not going to come out. And I asked him to rethink that. I says, I think when you reopen the gates, you're going to have a massive crowd at the front gate getting in. People are locked up and they're tired of being locked up, and I think they're going to come out. I think there's going to be a lot of people who might sit back and think about it for a little bit, but I think that in particular with amusement parks and when water parks aren't even considering the opening this year. So that's about my 2 cents on this thing is.
Great. All right. Well, you know, you got a wealth of information, and, you know, quite frankly, you're being creative as you give advice back to all of these attractions. And you're like our membership, you're pretty diverse in your clientele. And it'll be interesting to hear as people maybe are able to reach out to you is, why does the Oklahoma Zoo feel they're ready to open and the Cincinnati Zoo isn't ready to open? And we personally hope the San Antonio Zoo is ready to open in about 2 weeks, because we're going to San Antonio and seeing our granddaughter. So, and she wants to go to the zoo. So thank you, Ken. And I know you have a partner, Amanda, that works with you, and we look forward to, you know, perhaps maybe if there's an opportunity and the attractions and that you work with are willing and able to share some of their reopening plans, we would appreciate you forwarding those to me so we can forward them on to the participants today. So last but not least, the risk side. Jay, are you still with me?
I'm here, Tom.
I have to tell you, I mean, it's very difficult to talk 5 minutes about this important subject, and I really appreciate Crest Insurance hanging in there. I know in your own mind you probably figure out how to make a 15-minute talk into 5, but there is a whole other side here that needs to be part of your plan. If you're not consulting with your insurance and your risk folks, we would highly recommend that you do. They're a wealth of information. Generally, most of the time, they use common sense, but their heart in the right place, because their bottom line is they're there to help you to make sure nobody gets hurt. In this particular case, what can we do to mitigate the chances of people contracting COVID-19? So Jay, you're going to kind of close down the, how do we prepare a plan?
Yeah. I'm just going to take, give the bulk of the time to Rob Hawks and Tim Medcoff. But there's a couple things I do want to talk about. First of all, I am Jay Hyden with Crest Insurance. I'm on the benefits side of the equation, employee benefits side. But two things specifically I just wanted to discuss today is, we heard from Mary talking about the 100-point reopening plan, and Diane talking about how there's a ton of questions out there and you need to have a plan. And Amber, the big question is, how do I reopen? And Ed, you're talking about consumer confidence and how important it is that you have a plan, because that's going to drive consumer confidence. That's going to bring people back. So what we did is we developed, in conjunction with another organization, a strategy or a guide called Creating a Return to Work Action Plan. And that's really what it is. It's a guide to help you create your own return to work action plan. Everyone is going to be different, obviously. So this is what it does, is essentially answers a series of questions, or helps you answer a series of questions as it relates to your business. So things like, what do you need to know before you reopen, such as federal and state guidelines like CDC guidelines. You need to know exactly what you have to abide by, how to conduct a risk assessment of your business, how do you create a pandemic response team and who needs to be on that team, how do you modify your workplace, so the physical workspace modifications, workplace protocols, employee scheduling, those types of things, how do you disinfect your workplace, establishing safety protocols and guidelines. And then last is, now it's time to reopen. Now what do I do? So that document, that guide is, again, it's going to help you build your own plan. But Tom, I think you've got everybody's emails, and we can easily probably just email that guide out to everybody after the call. Right?
Yes, that is important. I think as other resource guides have been discussed, that we will put that out tomorrow in an email to everybody that was on this call, as well as our entire membership, because again, these all provide a look at best practices. Again, the goal is when the government say it's time to open, that doesn't necessarily mean you can open, because you don't want to open unless you feel you have a good consumer confidence plan in place. And again, involve your risk management. Jay, I think you said you want to go over to Rob.
I'm going to just mention one thing very briefly, just
okay.
Real quick. So first of all, I am a benefits guy. Remember that you've got 90 days to re-enroll people back onto your plan. They don't have to wait a waiting period. Okay, 90 days. So, but the benefits will take effect on the first day of the month following the date that they come back on board. All right. And what's important is, obviously, you're going to probably have to do open enrollment again for people. You don't want to get a bunch of people in the same room, clearly, and be talking about benefits. So utilize as much virtual technology as you can. So online enrollment, recorded open enrollment presentations that you can create a link and then email that out to the employees, and or virtual enrollment forms, call centers, those types of things. Just, obviously don't get people back into the same room together for those types of things. So that's it for me. Next person is going to be Rob Hawks. Rob is the Director of Risk Management for Crest Insurance. He's been with us since 2016. He's an authorized OSHA instructor, and he's trained on dozens of topics, and specifically personal protection equipment and hazards in the workplace. So, Rob, I just want to give you the chance now to be able to take over and spend some time on your topic.
Great. Tom, can you hear me?
I don't know if you can turn your microphone up just a little bit.
How's that? Is that a little bit better?
Yes.
Okay, great. Good morning, everybody. My name is Rob Hawks. I'm the Director of Risk Management for Crest Insurance Group. I will do my best to cut down on what I was going to originally talk about, because a lot has already been covered by prior speakers. Ken, I appreciate you bringing up PPE. I am an authorized instructor in both general industry and construction, authorized to teach in all 50 states for OSHA, and I do get state specific when they get state specific as well. As you can see in the background, I have some PPE that we've already kind of hit upon with some eye protection, ear protection, typically what we cover in OSHA classes. One is to divert your attention from my stay-at-home haircut, and the other is to just kind of remind people that this is more on a CDC issue. It is CDC guidelines. However, where we come in is to assist you with things like PPE. A year ago, if I had held up an N95 mask and even said N95, 95% of the people probably in this nation would have no clue what N95 was and think I'm speaking a different language. Now it's become one of the more popular phrases and searchable things that you can find on the internet, and it's trending almost every day. Where we come in to help is diving into those type of things, because that's going to be our new norm, especially for the midterm until we can get through this. Masks, gloves, those type of things is where we come in to help. One thing I want everybody to remember that's listening right now is I know this is a return to business, return to customers coming in type of meeting. One thing that we have done at Crest is, although we are Tucson based, we're a national brokerage. So I've worked with essential industry since the stay-at-home has come into effect. I've worked with meat packing plants from New York all the way to transportation companies to California. And just a couple important points is that Tim Medcoff, if anybody's been looking at the group chat, has brought up some great points. One of the things that he said is every place is different. To give you an example of that is I've been working with two different electrical utility companies here in Maricopa County that work with high voltage. And you would think that's the same type of industry, so they have the same type of issues. Well, no, one is in the air and they do the lines, and one is trenching and they do below, where they work beneath the land, where they do trenches and handle electricity. So for instance, even if you get into a string of subways, you're going to have different occupancies, you're going to have different sizes, you're going to have different exits. So every place is unique in and of itself. From the get-go on this, most of what I did, or about half of what I did, was I taught 22 OSHA 10s last year. So I was in the classroom and I was teaching a lot. With what has happened now, obviously that's gone by the wayside and we can't do that anymore. So what we wanted to do at Crest was really help not only our clients out, but everyone. And Jay, if you can, or Chris, if you're still on the line, if somebody can put in the group chat, we created a website open to the public with updated constantly COVID resources with it. There is hundreds of different tools that are completely open to everyone in this room if you go on our website and look at it. Just one of them is that I just pulled out today is we have a COVID checklist for return to work. Being that this meeting is about places reopening, we have a basic checklist that we came up with that, yes, every place is different, but we tried to put in like the 20 most important things that we think would be a good general reminder to everyone to do. Also, another thing that we have with our clients in particular is we have a risk management portal that in the past, it was very difficult to get people to do cloud-based trainings. Now, and I'm also a traditional type person. I love teaching in person. And it's been difficult to get people on these. Well, my job as the administrator for our risk management portal is now I'm having companies contact me and they now want it. Cloud-based training is the safest thing that we can possibly do right now. But also as resources that we have, great to have the county folks in here. Diane, folks, thanks for being here. Since my phone has been blowing up from the essential industry since we had the stay-at-home come into effect, the counties have been the most valuable resource that I have had when I've had questions. And Diane brought up things for you all to think about when you reopen. One of the things is policies and procedures that Tim Medcoff actually made a comment on as well, to have them in place. From the get-go, we put out sample furlough letters. We've put out telework agreements, work from home policies as well. Now on our portal, we have 16 different posters, all COVID related. Some specific examples are, one of them is labeled "Don't spread germs at work." Another one is a hand washing poster. Do not enter if you have symptoms. Stand 6 feet apart. 10 steps to reduce exposure. All these different things we have available which can help you out so you don't have to create your own wheel. we understand that a lot of places may not have their own risk manager or even their own HR department. So where we try to step in is provide these tools for free to everyone that we can. The safer, the better. Being in risk management, you can't be too safe, you can't have enough trainings. Another thing that Tim brought up where I want you to kind of think outside of the box that we've run into, he made a comment, Tim Medcoff did, he said anxiety is high right now. Although we're all thinking sanitation, hand washing, social distance, PPEs, let's remember that violence is the third highest way that folks die in the workplace, even before this happened. We are seeing violent responses to people being asked to put on masks. And those are things to think about as well too for your employees, where I really try to think outside the box and prepare you for it. Is those type of issues that have come up. For instance, to our transportation companies that we have, you may have a driver that's going into 4 different states in one day with 4 different regulations that may, walk into a place that they're not supposed to walk into or not have, proper things that they're doing on it, and they don't even know. So these are the areas that we try to think outside the box. We want to hit the basic sanitary, the PPEs, and everything else that we can. But also too, we want to be stocked up with these things. Another thing that we're seeing that's coming up as well is we may have company ABC that ordered just a ton of sanitary equipment in their office environment. And as they bring employees back, it's disappearing. It's not a matter of high use, which we always expect, but just remember that the grocery stores, at least where I'm at, and I go down to Tucson quite a bit, probably 2 or 3 times a month, we're still out of hand sanitizer. We're still out of paper towels. We're still out of toilet paper. If your business is stocking up with those type of things, keep in mind that they could walk off. Do you have an inventory system? Do you have a way to keep track of them? So it's a lot to think about. It's a lot to do. We're here to help out with those type of things. And I'll just kind of wrap up with that, and that, we've been working with essential industries since the stay-at-home has taken into effect. We've seen a lot. There's still a lot more that I'm sure I'll see, but we're here for you to help out with that as well, too.
Thanks, sir. I'm not sure. I know Tim has been communicating through the group chat. Are you still on, Tim? Or
I am.
Let's just at least say we can see who you are. And, please, a couple of minutes, let everybody know who you are and that you're available for help.
Sure. And unlike most attorneys, I'm going to try to be brief. I'm actually setting a timer. So for 5 minutes, so that I can respect everybody's time. I appreciate everybody's patience. Hopefully I can live up to the expectations. If you've been waiting for how do I reduce my risk and how do I protect my business, hopefully I can give you some nuggets that will help you. Rob touched on some great points, and I'm sure he's been very busy. Prior to this epidemic, OSHA was kind of an afterthought, I think, for a lot of business owners. And you're going to have questions, especially as you have people report that they're COVID-19 positive. Do you have to fill out an OSHA 300 form with respect to that? Typically you do, but there's going to be some questions of whether or not they actually acquired COVID-19 in the workplace. So Rob is going to be a great resource for you to reach out to. As I tell all business owners, especially in times of pandemics like this, you need really 4 people in your corner. You need a good insurance agent who you trust and has your back. You need a good banker, which all those of you on the phone that have applied for PPP, hopefully you haven't had to learn that the hard way. You need a good CPA, and the PPP has been very enlightening and with respect to that. And frankly, you need a good lawyer. Somebody that is your trusted partner that can help you. And our team at Faring and Medcoff, I'm very on top of this issue from day one. We continue to push out legal alerts to our clients and on our website. I added the website for both Crest and myself into the group chat. There's lots of great resources there with respect to COVID-19. So with respect to these issues, there has been some talk about developing a plan. You need to be preparing now for reopening. You need to have clear communications for your employees and your customers. If you've stayed at an Airbnb or a VRBO more than once, this analogy will make more sense to you. But if you think about the Airbnbs and VRBOs that you've stayed at that were really awesome, Probably the reason why it was awesome, besides, you know, a good price and a great location, is that the owner really thought about your needs and what would make your stay more pleasant. So I encourage you, especially most of you on the phone, if not all of you are in the attraction industry or business, think about what it means to walk through your attraction as a new customer, a new client who's never been there before. Walk through your workplace or your environment. Look around. What is a customer going to see? What do you think they're going to ask? What adjustments do you need to make sure that the workplace, the environment, the attraction is safe, that you're directing traffic in an orderly fashion to help promote social distancing, and then making sure that you have the appropriate policies and procedures in place that are published. Diane mentioned this at the beginning, and that's really important. You're going to want to make sure before you open you're adequately insured, whether that's employment practices, liability insurance, proper workers' compensation, riders for wage and hour claims, commercial general liability, all of those things. The COVID response team is going to be key. I mean, like anything in a good relationship, communicating clearly and effectively, right? Our marriages, significant others, those only work if we're talking and we have open lines of communication. Same thing with your workplace. You need to have a cleaning czar. You need to have an HR czar, and you need to have a communication czar. And those people are wearing different hats and have different job duties and responsibilities, but they need to be providing policies and procedures that are consistent, and they need to be providing the same answers to the employees and the customers every single time. And that's why you want to designate somebody to handle those topics for you. The other thing that has been really kicked around a lot is temperature testing. Is it a good idea or not? There are privacy rights. It will help reduce your potential liability if somebody tests COVID-19 positive and brings a claim with either your workers' comp carrier or takes it home and gives it to a significant other who then gets sick, and then they try to sue you for liability. And I'm going to talk about liability briefly in just a second. But when you do temperature checks, if you do it, you want to make sure level screening. You want to make sure you're doing it in a private area where other coworkers aren't getting the results or hearing the results. You need to consider staggering times when people come to work if you're going to take temperature checks, so that there's not a lot of delays and waiting time, because odds are most of that time, if not all of it, is paid time for the employees. And then how do you handle an employee that actually has a fever? What do you do with that employee? How do you handle it? I suggest if you can have a private exit for that person to skedaddle through, as opposed to having to walk back through your other employees and potentially infecting them. And that way it allows them to have some privacy. On employee tests, if they have symptoms or test positive for COVID-19, what do you do? Obviously, you need to send them home. You need to tell them to talk to their doctor and find out if they're actually symptomatic and have COVID-19, and keep you apprised of what's going on, so that if they actually are COVID-19 positive or they're quarantined by a doctor, then you may be able to take time off under the Families First Coronavirus Response Act. That also allows you to get a dollar-for-dollar payroll credit. You then also need to engage in contact tracing to make sure that if they were at work and were sick and you sent them home, that if somebody at work was exposed, that you're isolating them and having them talk to their doctors. As I mentioned, legal liability, just real quick. These cases are going to be judged by a judge or jury a year and a half, 2 years from now. Juries, by definition, in my opinion, and I think we have the greatest legal system in the world, bring common sense to this situation. And so they're going to look at your policies, your procedures, what information have you communicated, what steps are you actually taking in the work environment to keep people as safe as possible. Nobody knows who's carrying the disease. It's not like somebody's wearing a bubble over their head saying, hey, I'm COVID-19 positive. Obviously, if they were, it'd make this a lot easier to control. It's an invisible virus that nobody knows if they have it until they start showing symptoms, which can sometimes take 2 or more days before they become symptomatic. So a judge or jury is going to be looking at this. Did you, employer, do something wrong? Now, most of you are going to be covered through a workers' comp claim, and if your employees get sick at work, and the carrier is going to ask you for your policies and procedures and documentation showing that you actively cleaned everything. And if so, that's the information that you're going to want to present to your employees on that. And then finally, last thing, what do you do if an employee refuses to return to work? You have rights, they have rights. This is not an easy topic. This is a time for compassion, not creating walls and barriers and meeting the workforce. So just be strategic about it. Consult with your resident experts, whether that be your insurance agent, your HR rep, or your attorney. Best of luck to you.
Thank you, thank you, thank you. Appreciate everyone's efforts today. Again, I apologize for going over. Obviously, this is an important subject, and we wanted to give everybody an opportunity to share their thoughts. If you have a question, please, we're probably going to get off here. If you have a question, please type it in right now, or if it's there, and we will send that directly to the individual and get the answer back to you. But I think it's, to be fair to everybody, we should wrap this up. And Wendy Roundtree, would you please come on as the president of SAAA? I'm going to sign off, but again, we really appreciate you all being on the call. As I mentioned, we will get these resources out to you. We recorded most of this session. And we will send that along to you as well. So Wendy, are you on?
I am.
All right, go ahead and close her down.
Okay, well, I really want to thank everyone for attending this morning, and a special thank you to our panelists who made time in their day for this meeting, and a lot of great information to sort out and great information that was shared. To the SAAA members, I would like to encourage you to make sure you fill out the survey that was sent out a couple of days ago so that we can gauge where you're at and do our best to help you where we can. Thank you again for everyone's time. It was great seeing everyone, and enjoy the rest of your day.
Thank you very much. And I know Laura appreciates you bringing up the survey, because we had to kind of cut her off because we ran over. So I apologize, Laura. But the survey is very important. And I have to tell you, we've had over 15% of the folks. If you haven't filled out the survey, as Wendy indicated, please do so. But given the responses, this webinar was very timely, and we hope that we answered a lot of your questions. But again, this is meant to be a resource. We didn't think anybody was completely done with their plan, or some folks had just started their plan. So we hope that we've been able to provide you with some useful information. Again, if you have any questions, please email any of the executive committee, and especially Wendy and I, and we'll be glad to help you. Thank you again. Have a good day.
Thank you, Tom.
Thank you.
Thank you.
Bye-bye.